Thank you for joining our webinar today. My name is Deanna Knoll. I'm the VP of Client Experience at IMT, and I'm going to kick us off today. On today's webinar, you'll be hearing from Brendan Fowkes, the IBM Global Healthcare Industry Technology Leader, and Mark Holmes, IMT's VP of Solutions, will be presenting most of the content here today. Both bring a very deep history and level of experience in health data management. And today they're going to share their insights on both AI opportunities that are gaining a lot of interest within healthcare, but also speak about the most important foundational components that are needed to have secure and governed data that can bring the benefits that AI is hoping to bring. So very quickly, Brendan leads the IBM strategy for the adoption of ethical AI to drive real business results across the healthcare ecosystem. So that includes health plans, providers, governments, and life sciences. And Mark leads IMT Solutions in sales. And for more than 20 years, he has been at the forefront of enterprise patient data management solutions, both building and implementing them for some of the largest and most complex organizations. You see a lot of familiar faces here today, so some of you may actually know him very well. So IBM is a Gold Business Partner. IMT is an IBM Gold Business Partner, excuse me. And we bring more than 30 years of experience to health data management, integration, analytics, and have been implementing IBM solutions for data management across North America with a focus on healthcare and government and health and human services, as well as provincial client and provider registry management. Just a quick introduction for maybe those of you who haven't met us before. So I'm going to go ahead and kick us off. Talk about why we're bringing you this topic today. So, if you're awake and alive and not under a rock, it's clear that the promise of AI is everywhere, and the race to determine how benefits can be reaped from that, but in a safe and reliable way, is top of mind at every organization. So some of the key statistics here that came from a report from the IBM Institute of Business Value, Healthcare in the AI era, and we will share you links to that and recommend that you go ahead and download that. Talk about some key statistics around the industry when they've surveyed top executives and where they think the benefits could come. So those span financial performance, productivity around staffing, particularly as it relates to staffing outages and or ways to be able to better accelerate both operational and clinical collaboration functions. And then looking to see how this can also help with the payment and better coordination across the healthcare ecosystem, across payers and providers around claims management. But I think it's no surprise that the same challenges and concerns still remain on how do you make sure that the data is secure, patient data is protected, that you have the tools that you need to be able to implement the policies that are needed to make sure that data is AI ready, and the outcomes of AI that use that data can be trusted and safe. So I'm going to turn this over to Mark now, and he's going to talk a little bit more about kind of the history of where we've been and data management as it relates to these challenges, and take us into looking to our sights to the future.
Thanks, Deanna. Good morning, good afternoon, everyone. And again, welcome to our webinar today, where we're going to kind of take a look at nostalgic look rather at data in healthcare, kind of understand where the industry is currently, and then with Brendan's help, we're going to help then understand where healthcare is heading with the the many advancements in artificial intelligence and machine learning. Now, Brendan and I have been running together since early days in healthcare, when customers were simply looking to match and link patient data across disparate data sources. 20 years ago, with increased M&A activities, data fragmentation led to inefficiencies, increased cost, and missed opportunities for better care, which led to the development of the Master Patient Index. With increased demand for healthcare data and population health, we saw the need for additional data domains such as provider and delivery location, which led to the Enterprise Master Patient Index, where sort of data propagation allowed clinical data warehouses to use Enterprise ID to enhance data analysis capabilities, and this really facilitated accurate and comprehensive extraction of valuable information. We then kind of realized further advances in support of multi-entity needs in healthcare, which again sort of redefined how we looked at data and introduced a more comprehensive approach with the advent of master data management. Okay, next slide.
And the interesting one, we still come back to the EMPI need. I had a sad but funny story with a colleague I was traveling with the past week. He's a junior. His father is the senior. They live in the same neighborhood. He had an event where he got admitted, and they admitted him under his father, and all his father's medications propagated into his record. So he's been spending the past few weeks cleaning up the two records and splitting them up, old school style. So Mark, we've been running this conversation for 20 something years together. It still happens sometimes, but it happens.
Yeah. Yeah. And, once again, we're sort of facing additional demands for healthcare data to support a number of different modernization initiatives. And this is where I want to kind of sort of pivot away from what was to what's happening today. And Brendan, and then get your take on where we're going. And, I'll drop a shameless plug here and say that, IMT has implemented and supported over, 200 MDM customers over our 20 years. Over 20 years. And what we're seeing now are really tighter regulations and evolving standards, along with rising costs and administrative efficiencies, revenue cycle management concerns, and patient engagement requirements that are really forcing our customers to modernize their approaches to healthcare data. And this goes beyond, our days, Brendan, with simple entity resolution and an EMPI, with simple governance tasks, to really building a strong data and governance foundation, that supports better decision making, improved patient care, and operational efficiencies, right?
Yeah, and it's really is like as you look at revenue cycle and patient member experience, so we start on the left, the business imperatives of today, it's no surprise. The costs are out of control. Some of the health plans, their medical loss ratio, their MLR is brutal. So anything we can clip off from an administrative piece, I think it's almost the right time, an inflection point in the industry between government mandates for interoperability and this idea that, hey, we can't keep spiraling and having this AI arms race between providers and health plans. We have to be working together, but that requires a data foundation that you're going to need if you're going to look at this claim is likely to deny. What's the historical evidence? The data has to be right to say, hey, this might get denied. Let's fix it before it goes out. Or a health plan says, oh, you know what? I actually know what data should be just filled in. Let me just fill it in and get the claim moving. And then there's a lot less friction in the system. So that's based on that. And obviously, that's a better experience for everybody. People in the billing office, the people on the health plan side, at the end of the day, most importantly, the patient and members. It just can make their lives so much easier from that point of view.
Next slide, Deanna. And really, and that's where we're seeing the need to move, more from a single application, to more of a platform, right? So like IBM's Cloud Pak for Data, that really embraces, a data fabric, as an architectural approach, which is designed to simplify and secure data access and facilitate, self-service data consumption. And, IBM's approach on this, end-to-end data fabric, it includes capabilities like data matching, observability, master data management, data quality, real-time data integration, governance, and security, all of which can be implemented without replacing existing technology stacks. And,
I think that the lineage piece is really important these days because people really want to understand the transparency and explainability of, if I'm using a system, why did I get this answer? People care more than they used to. They don't just say, give me the answer. They want to research a little bit more to make sure. And that's where the lineage comes from. You have to say where that data was, why it came up with that. Okay. And then more important. It was used to be a nice to have. It seems to be much more of I really need to have this nowadays to make sure that the data is trusted along the way.
Yeah. And I mean, that, the data fabric really introduces a new data intelligence and the integration tools to prepare data for generative AI, right? And, this helps to ensure readiness for both structured and unstructured data in AI initiatives. And, so now, Brendan, that, customers move forward, they've implemented a solid, data foundation like Cloud Pak for Data. Like, what's next? Like, what is IBM envisioning moving toward with the integration of AI and machine learning to advance modern data healthcare.
Yeah, and that's where it starts to get fun. And there's no bad ideas right now. It's really understanding an ROI metric. What's the ROI we hope to gain from any investment these days? There's a lot of experiments going on, a lot of successful experiments going on, but you can pilot yourself to death and not get production ROI. So what we're really helping do is understand, it's sort of a conversation about what's the end goal, what's the ROI, and what's the feasibility of building that. So the combination of all those three is you run through this sort of golden thread of the vision of what you want to do, because at the end of the day, if this data foundation isn't there, you know, a 70-person, 100-person pilot doesn't scale to, you know, 3 million visits a year. It just doesn't, because the cost and flexibility of using some of these models, the scale just goes right out the window and you lose your ROI. So we're really focused on driving that. What is the ROI we want to get? How do we get there? And what's the foundational components you have? Because if this data foundation is not in place for that particular use case, it won't go well. You'll be scrambling and things on those lines. So like you said, we're talking about revenue cycle system. If you don't have that historical claims denial history and the why and which billing codes it was underneath, and this and that, you can quick search, your AI model can't predict, even if it's basic machine learning. This is also machine learning, just predicting a readmission, predicting a denial. You don't have to use generative AI for everything, because sometimes it's not very good at math. So things along those lines. Those are just some ideas of where to go and how to get started. But it really is, what is that sort of flywheel for growth? And how do we get from A to B? You know, like I said, the use cases are really unlimited. There's a lot of stuff on physician clinician burnout, ambient listening. There's some great companies already doing that. We are really not focused on that at IBM. There's ad tech and nuance, you know, all people, and modal, I'm sorry, they Solvementum now, because they're not even 3M anymore. There's companies that have been doing that a long time, and that's a huge benefit. And people should be doing that, helping clinician burnout. We're not focused on that because that's almost a commodity now. We're focused on what are the things you need to move forward with next, not in that clinical space.
Hey, Dan, you want to go?
Yeah, so as we're thinking about this innovation flywheel, I was already talking about it, but you start thinking about it, and sort of a little bit of what we did, just so everyone realizes. So we had a discussion the other day with a large organization, and we had this discussion. We were having a funny conversation. I like to use the analogy, we're drinking our own champagne. This CEO said, well, we should eat your own dog food because, you know, the dog's got a bar. I was like, okay, we're going to go back to dog food. What IBM has been doing is leveraging innovation at scale. We have had to, we test this on ourselves. People sometimes forget, what do? We're an automation company that's trying to drive innovation for our clients powered by data and AI. That can be an IT company, that can be supply chain, that can be, you know, whatever it may be. We've done this all ourselves over the past 2.5 years. And in driving that innovation, we've documented $4.5 billion in savings, productivity gains, supply chain savings, you know, stuff around HR, whatever it may be. That becomes the investment that fuels the next phase of our AI journey. It's allowed us to invest in things like HashiCorp, automation for IT, you know, things along those lines. It's allowed us to go pick up Manta, the data lineage team for the data fabric, you know, things along those lines. You know, that's just where we're going with this. And a lot of it, what we're doing is around the governance side of it too. That's IBM proprietary investment work coming out of IBM thought leadership from research. But how do we govern all this? You know, you have a governance risk compliance team that's worried about certain things about audit and whatever it may be, and then great. AI governance is slightly different. And what we've done is a lot of investment in that software. Once again, automating that everything. Once I have an idea about whatever I want to do using an AI thing for patient engagement, Okay, let's look at, make sure it's regulatory compliant. I'm in California this morning. Is it compliant with the California Patient Privacy Act, the EU AI? Automate that, and there's a huge cost savings that drives innovation. Says, listen, by the way, when we use this, it used to take us 9 months to work on a project. Now it takes us 2 weeks. That we can start working on a project. So there's thousands of hours that can be saved, documented, and then that comes back into fueling the next investment. We want to start small, go fast, provided we have the data foundation, and then we can really go forward from there. And that's a lot of how to get started. Pick something, pick something, but that's where the governance piece is. Govern it, make sure I want to go there. This is what we want to do. Where's the ROI? And what the ROI is, a top line. You're going to add more visits. That's more revenue. You're going to reduce no-shows. You're going to basically improve productivity for the billing people, for people doing prior auth, the nurse case managers in your health plan. What is the productivity gain? By hours, by dollars, by FTEs. You pick it, we'll help you document it. We'll work together. And, we're always working with the IMT team on the data foundation side. We'll all work together and say, this is the productivity you're going to get to fund the investment. Document you got that. Okay, what's the next use case? And that's a lot of how this just starts to go. And it's really starting to fly, Sorry, I used to fly wheel, call it fly. It's still morning over here. So as we go through this, I have a couple examples, like you said, if there's any questions, feel free to chime in. But it really is, when you pick the ROI, there's that last thing, the feasibility. Can we build it? Do we have the data? And do we have the ability to access that data? That's a big catch. Are we allowed, the patients or members consent for that data to be used to build something internally? Do they consent? Who did they consent? What did they consent? With whom? And for how long? That's okay. It's all good. Let's go build something fun, because we have that data set for billing. Or, looking at one of the great case studies we did, and I didn't put it in the deck, but it's, here in California, we were working on a predictive model for unplanned diabetic admissions. We knew we had the data in what was called the book of record. It's this huge data warehouse that we built in conjunction with some of our tech, some other people's tech. And so we knew we had the data. And the great thing is, the project manager, he since moved on, as we got ready to really kick off the project, he said, you know what? I don't need a predictive model that's 92% accurate for one population. We serve a massively diverse population here in California. Get me 80% accuracy for everyone, and my care managers will be excited, because right now they have nothing that's data driven. They have instinct and they hope it works. We got to 82.5. So that 80% comedy throughout, and the care managers loved it. Once a month, that report goes in. We know it's free of bias. We know it's fair. It's transparent. They understand why Brendan made the list last month. He might have an unplanned diabetic event. He wasn't on the list last month. What happened? That governance, transparency, explainability, and lineage for just a simple predictive model was there. So the care managers took it from there.
So is that really what with I think with the stat was like 80% of all AI projects never make it to production. Is that why? Just the underlying governance is not there?
Sometimes a lot of times the underlying governance is not there, but also the underlying data. Like a lot of times what we've seen, and this stat from the MIT study said 90% don't work, and there's a lot of that are successful these days. They're just not making the noise that everyone else is. You took a pilot population that was small.
Right.
And when you went to scale it, you didn't have the data availability you needed for the accuracy of the model to be within a threshold you want. If you need a model to be 92% accurate or above, when you test it on 50 people, you can get to that. When you test it on 500, 300, 3 million visits a year, your accuracy scores plummet because you didn't have the data underneath. You didn't have the data infrastructure underneath to make it work and score properly. So that's a little bit of what we find I used to call it pilot purgatory. Great ideas that don't go anywhere. One, because the ROI wasn't documented. Two, what does success look like? What is the threshold? What is the accuracy score? Is it going to be free of bias, free of fairness? Things along those lines. What can we do to make this thing better? I think there was a question.
I think they call that shadow AI, right? Where they've not been able to clearly articulate the problem, right? So they've.
Yeah, that's one, and that's the other thing, the shadow AI project. There was a question in the chat that flew by. Hold on, let me grab. I did see it. Why can't I get the chat to come up? Here we
Yes,
go.
there's a question. I can read it if you want. I was going to hold it.
Okay.
But yeah, the question was, how does IBM's AI governance framework ensure HIPAA compliance when handling sensitive patient data?
That's a great question. So part of this data fabric is a catalog. Inside the catalog, as we call IBM Knowledge Catalog, is the ability to have role-based security in everything you do, or full obfuscation of the data. You can tokenize it for research. Like there's massive levels of thresholds that you can take. You can overcomplicate it. Don't do that. But it's actually inherent in the program and in the platform to ensure that no sensitive data gets exposed right from the jump.
And that's a great point because, traditionally EMPI, or MDM, the data model was very, very small, right? We were looking at demographic information that was used for purposes of matching and linking. But now we're looking at much more data, which, as you said, really requires a robust governance solution to be able to do that and catalog the information across the enterprise, right?
Yeah, and those are some of the big things. Sorry, my battery's not connected correctly right now. But yeah, those are one of those things. I mean, privacy, we weren't going to get into too much. Privacy by design, security by design is how we think about it. There's sort of two strands of the same DNA cycle, if you think about it that way. That's in everything we want to do. Every solution we want to design for a client. Right now, AI is the new attack surface. My security people scare me. That's why they work in security, and that's why we have them. We weren't going to focus this one on security, but privacy and security is so important when doing this work. And one of the things, if you just want to move forward. So in one of those things, intelligent workflows. If we think about this, we all know, oh yeah, that process takes forever. Oh yeah, that's slow as molasses. Really? Do we have the data on that? Process mining is a unique way to look at the first step of what process is actually broken to get started. Do some root cause work. It's a data problem. And then you figure out what the new action would be. What's the reimagined way of working? What's the process redesign? Because if we want to do work, we have to redesign the way we think about the use of AI. So for an AI use case, we have to say agentic AI. That's like buzzword bingo for 2025. That's all the rage. But whatever that framework is that you need, what are we measuring? What is the benefit tracking? And you really have to think through that closed loop. That's I have an idea to what are my benefit metrics? What did we decide was the root cause of the issue? What do we do? And then how do we correct the issue? And these can be, they don't sound simple, but they can be simple. And you can create massive improvement in an organization. I'm going to give you one or two examples. So if we go to the next one, as we go through this is one from our friends over at the National Health NHS in the United Kingdom. So theater is inpatient for us here in the States, and in Canada, outpatient is evident. What they started looking at was, we call them no-shows. They call them DNA, do not attend, which is very confusing because DNA makes me think of, DNA, strands. But anyways, as we think through this, we started looking at the no-show process and why they were so high. And it was actually there was some rudimentary things that we found because people's appointments were so far out because they have such a massive access problem. I mean, we have access problems here and we have access problems with our friends in Canada. This is a whole nother kind of special. And the fact that by just correcting processes, They just started releasing appointments, and people that were backlogged got in. It is the #1 political issue in the United Kingdom. It's access to the system and the quality that the system gets. If you can solve little pieces along the way, your party will be in power forever with the NHS at this point. I was there last June when the doctors went on strike a week before the election. Can't make this stuff up. That's how important this stuff is. But just think about that. Here in the United States, you free up appointments, that's revenue. That's top line growth and patient experience and Press Ganey scores. There's a circular piece to this that works out really well. And it didn't have to be fully agentic. It was really just some process redesign and documenting the metrics to just do a little good old fashioned business automation. We didn't have to go full on agentic AI. It can be simple and powerful, because the simple powerful will fund the more advanced stuff and the more advanced work. And then you get better data quality, and then, all on, it snowballs. But then one of the other ones that's great also, from one of the quotes in that initial findings that Deanna put up at the beginning, was around staffing and working with the people. So now if you've freed up new visits and more people getting into the hospital and the right people coming in, we also need to make sure that they're staffed appropriately. Move forward one. And so we did this work, with a company in the Pacific Northwest, and this is one of their slides, if we move ahead, that they presented at HIMSS about 4 years ago now, on stage with one of our data scientists. And it really was, Kronos and whatever API Healthcare is renamed after GE bought it and spun it back off. Great systems, but they're not that intelligent. You have to feed it a schedule. Is that schedule optimized? This was a great idea of sitting down. We had to have the data. We have appointment data, visit data, the ED data. We did the pilots in the ED, acuity, and then we did hours, salary, payroll, HR. So those are two very different data sets. Those went up. They were governed, they were managed, they were in the data fabric. We were then able to talk and look at optimizing the schedule. And we tested this at one inner city hospital, big inner city hospital, and one small rural community hospital in the emergency department. And both of them saved $500,000 in the pilot work. That then they rolled in and anticipated close to 50. Now they're a lot bigger than most places. But 60% of the cost of your entire organization is your people in running a health system. How can we optimize those folks? Especially if we're going to free up visits, we got to have the right people in the building to care for them. That's real gain. That's real savings. That's real opportunity. That's real growth. What's the next thing we want to do? Maybe you take that, and that's what feeds investment in one of the ambient listening tools for your clinicians, so that they keep the burnout going. And then we work on revenue cycle. There's no wrong place to start. Just get started. We can help you govern the data. We can help you govern the process and help you deliver on real results, real documented results. And we'd love to have some of you folks on stage with HIMSS and us, or health. Was it health this week? Last week? It was this week or last week, whatever it was. We'll go talk about this together. Tech Exchange was a few weeks ago. We had some healthcare clients speaking at Tech Exchange, and what they're using, how they're using AI, how they're using the data fabric. We really want to, our client success is why we're all here. But, from an IBM point of view, Mark, you plugged yourself. We can't do and deliver at scale for our diverse healthcare clients without people like IMT. We've been working with IMT I've had the pleasure of working with them for a long time. If you are not familiar with them, this is a great organization. They deliver. That's why they partner with us. So scale, we can't scale without partners like IMT day to day, especially in the healthcare environment, because they know it.
I appreciate that plug.
Oh, no problem, Mark.
Deanna, do we have any more questions?
Nope, not at this time.
Do you want to open it up to questions now?
I do think we have one more slide.
Okay.
Okay. Oh, yeah, absolutely. The trusted foundation product. Hey, by the way, we keep talking about data fabric and we've talked about the technology. Obviously, we have an integrated story about what we can do. And once again, this is another thing, and one of my bad jokes that I take is, for 34 billion reasons, all of our stuff can run anywhere and with anyone. So gone are the days that we have to rip and replace everything. We used to go take on someone and we're going to rip out that box. I'm going to put this box in and it's all or nothing. The beauty of an open hybrid strategy is what you're doing today is good. Let us complement it. Are you missing the data governance, the cataloging? You need the observability, the data pipeline? We can basically modulate, we can deploy any of these features where you need it, when you need it, in anyone's cloud, all on premise, to complement and accelerate the work you're doing. Because when we have that foundation of the fabric, that's where the AI starts to sing. And you can start basically taking care recommendations and do AI nudges. Think about your watch telling you, hey, you got to get up and move. What if your watch already knew about the fact that you are a pre-diabetic and what did you eat earlier today and give you a nudge? You got to have the data, but you can do something fun with stuff like that.
Yeah, and it's interesting because particularly when you look at the focus on the data fabric there, and that's really where IMT operates, right? So for those who have been on, the Initiate MDM SE solution for a number of years, that's what we're moving forward. A number of our customers now are moving on to Match 360, which is part of Cloud Pak for Data, right? And that is that integrated platform that is, indicated here with inside the data fabric. And there's just too many advances, I think, to get into here. That was not the intent of this. But what we do want people is to follow up and let's have that discussion around modernization and talk about IBM's focus on governance and a much more sophisticated matching algorithms inside Match 360. Moving to graph database, multi-domain, multi-entity, same as MDM-SE, improved matching capabilities with the advent in the integration of global name management. I mean, these are exciting times inside just, the small little area that we focused on a number of years ago, right, Brendan? With matching and linking, it's still important. Match accuracy is still at the forefront of a lot of these initiatives, right?
Yeah, exactly. I mean, I made the joke about one of my colleagues. He got matched incorrectly, and now it's a pain in the butt, because he's got his dad's meds on his own thing, and that's mistakes happen. If there's a way to make it easier, we can definitely do that. We had a couple questions here too. We have one from Brian. How are healthcare organizations creating governance frameworks that allow departments to move forward, understanding what is acceptable use of AI and under what conditions, e.g. disclosure? That's a great question, Brian. I think folks are still struggling with that a little bit of how do you take AI and get into an AI ethics committee? We named a chief AI ethics officer 10 years ago. Dr. Francesca Rossi leads that organization still today. So we think about it and they work hand in hand with our chief privacy officer, our chief legal counsel, HR. So we think about this every day. And we're happy to teach organizations how to do it themselves. Deloitte can charge you; they'll charge $1 million to do it. We'll just invest in you to tell you how to do it. Dr. Francesca's gone and met with clients. I've hosted her in webinars to teach people how to do this. Our chief privacy officer she recently retired, doing the consulting thing. But Christina Montgomery, she was on the Capitol Hill with Sam Altman, 18 months ago, and answering these questions around AI. We can help people get there. A lot of people are getting there. They're getting the frameworks, they're getting the people. We can help you automate the process to go faster. Okay, I've got a couple more. So, got another great question here. Monitoring governance. Where does What's Next monitor governance and validating AI models post-deployment? So from a governance point of view, I'll do that one first. Coming forward, we think about governance from 3 different pillars. There's the life cycle of I have an idea. The idea gets documented. It gets reviewed by all the compliance laws. It gets reviewed by the privacy office. Then people work on it. During evaluation, we test all the metrics to prove you're within thresholds you need during your evaluation. Use whatever tools you're using, SageMaker, you're using Bedrock. We don't care. We'll monitor the evaluation during. And then when you get in deployment, we monitor it after the fact. And this is where, okay, now I'm going to be agentic. If we have an issue, for example, and something goes out of threshold, so for all of a sudden, this model got biased, or the accuracy, somebody was asking about Lyme disease and it was completely wrong, you alert someone, and the governance program not only alerts, captures the remediation options, creates a ServiceNow ticket, and then submits that ticket to the engineer that needs to fix it. So that's where the automation starts to get playing. That's the orchestration piece. That's our agentic framework. Governance to the next level. So we capture all the information, and it automatically goes to a ServiceNow ticket for someone to actually correct it. Because I think everyone's got ServiceNow. That's how we use it. That's a great question, because that is a big piece of it. Is monitoring what happened, when it happened, how it happened. And then the other thing, for example, if there's a change to the EU AI Act, what do we have to do? Well, we have to change things. By the way, patients that live in Europe, are European citizens, and you care for them, guess what? You're on the hook for the EU AI Act if you didn't know that. So something changes, we can monitor that. What are the best practices for recommending operating AI in clinical workflows while maintaining patient safety and trust? Yes, the clinical workflow discussion is always an interesting one. It can be done. It always can be done, but where is it optimized and where can we actually do it? Part of it is how easy is it to integrate with particular EMR vendors. I used to write EMRs that generally closed proprietary systems, so I used to be part of the problem. So I get that. But as we think about these things, back to what's the use case are we driving at? I think, once again, the documentation stuff, that's a no-brainer. Everybody should go do that. If you haven't done it already, go do it, please, because it'll add a lot to, like I said, we're not doing it. What's the workflow that we're going to do? We're doing more a little bit on the administrative side. We've had a lot more success there than getting into the true clinical side. We used to do some of that. We spun it all off. We did some great stuff, AI for radiology imaging when we owned Merge, the RIS-PACS company. That stuff's over there. They've embedded that. So it depends on the clinical workflow and the optimization gain you want to get. There's a lot going on where, the Siemens, GE, Merges of the world, they have that stuff in clinical radiology workflow. We govern it. So we're in the workflow, but nobody knows it. So, we're the governance program. So when you send an RFP, RFI out to one of these imaging vendors and ask what is their AI governance policy, some of them might respond. They use Watson-X governance to monitor everything. It's a real simple response that we've seen vendors use with us. So sort of embedding into that workflow. It's a trust thing. It, once again, comes back to the use case. Can we do it? Can we recommend how to do it? Absolutely. Can we also tell you when it's a bridge too far? And what the other thing is, one joke is, someone tell me the best practice. I'll tell you the best practice, but I'll also tell you what pothole not to step in, because sometimes we've already stepped in them. So we've seen it, and Mark and I and Deanna have seen a lot of things, and it's like, no, please don't do that. We saw that go wrong. You think you want to do, don't do that. There's been a lot of those over the years, but that comes from experience, and whatever we can help people avoid gaps, we will. Great questions. Thank you very much. Appreciate the questions coming in. It doesn't look like there's any else. Closing thoughts, give people 20 minutes back around lunchtime on the East Coast, or so one of these things. So we quoted some of the pieces early on. Deanna did the report, AI in healthcare, publicly available. Thank you. The link's right there. Please download that. It's good reading. The IMT Data Fabric ebook, that's a great one also, because like I said, partners like this that understand healthcare and focus on the healthcare industry, that's how we differentiate with our partner ecosystem every day. It's folks like IMT. That's why it was a pleasure. Happy to join this call with people that I know very well. and because I know we work together and I know they deliver for our clients. So it's a pleasure to join. Thank you for having me.
Thank you, Brendan.
Mark.
Thanks for joining us.
Yep, thanks, Brendan. And yeah, as he mentioned, we'll send this deck out afterwards, as well as, links to where to get some of the additional information. Both are free of charge. And I think that some of the questions that were asked in the chat too, talking about some of the application of data policies, knowledge catalog, things like that, goes a little bit deeper in those areas in the ebook. But at any time, please don't hesitate to reach out to IMT through Mark or directly to Brendan. We have their contact information there, and we can go into a deeper dive on what your particular challenges or opportunities are that you're evaluating, and kind of pull back the covers a little bit more on kind of the solutioning of what can help contribute to the data foundation. Okay,
Thanks, Deanna.
thank you so
Thank
much.
you all for joining.
Awesome. Thank you, team.